Today we're going to do a little myth busting on the statement that there are no coverage gaps in the state of Wisconsin. There actually are. This fits into a broader conversation right now in the state of Wisconsin as the issue of Medicaid expansion is being debated. A talking point that started under the last administration was that we don't need Medicaid expansion. We don't have coverage gaps in Wisconsin like other states have. But we actually do. And we're going to go and look just at Badger Care Plus, our version of family Medicaid in Wisconsin, for some examples of how people are being left out of the coverage system in our state. So political slogan aside, we know there are coverage barriers that come in the form of red tape, bureaucratic hoops and hurdles, and glaring holes in access to care and coverage in the state of Wisconsin. As folks point to Medicaid expansion as a solution to streamline systems of administration and make it a little easier for people to navigate healthcare and coverage, we also have some suggestions of what should be included in that conversation when it comes to consumer assistance and efficiencies. And we'll talk about that in just a bit. But let's look at some of those Badger Care Plus rules. Here's on paper why people think there's no coverage gap, and it's just the split in eligibility between private insurance and public benefits. Badger Care Plus in Wisconsin is available for adults without dependent children and for parents under 100% of the federal poverty level. Once you get above 100% of the federal poverty level, that's when folks, in theory, should be looking at private insurance. That's where eligibility starts for the marketplace, with the opportunity for some cost savings in the form of tax credits for people who are eligible. But what about finding your way through the application process and actually connecting to those programs in a timely manner, or remembering to renew your coverage each year for Badger Care Plus and the marketplace? That's where we lose people, and therein forms the gap. But there are other instances of where gaps arise, and it comes right out of the gate for Badger Care Plus. Like I said, we're going to look mainly at Badger Care Plus in this conversation. We could talk all day about private insurance gaps as well when we think of short-term plans and limited service plans and even direct primary care where you're just paying for specific services, but should a catastrophe arise, you're left uninsured. So we'll talk about that in a separate video. Let's focus our attention right now just on trying to get through the existing Badger Care Plus application. You have to prove your financial eligibility, and for some people, that's a dead end right there, trying to find pay stubs or proof of the income that they're reporting, even counting income correctly, which might be a challenge if you're self-employed, if you're a farmer, if you have a lot of deductions, if your income fluctuates every month and you have trouble tracking that down to pin a number down for current monthly income. We lose a lot of people out of eligibility right there, people that should be enrolled but are struggling with that part of the application. We then can look at the non-financial eligibility, which poses hoops and hurdles. Immigration status is a big one. There are limited versions of status that make you eligible for Badger Care Plus. There are a couple other programs if you are a non-qualified immigrant, but if you're in a changing status, if you're a legal permanent resident and you haven't been in the United States for 5 years yet as an adult, there could be hoops and barriers in your way. And we lose a lot of people out of eligibility right at that non-financial consideration step. Then there are access to insurance rules largely for children. There's verifications of most of the rules along the way. And these are the hoops and hurdles we're talking about that are keeping people from the coverage they should be entitled to, but they just aren't getting. Then once folks actually have Badger Care Plus, if they're actually using it correctly and getting the services they're entitled to is a whole nother conversation. And a lot of times we're seeing people that have cost share or some other personal responsibility, as it's often called, that's actually keeping them from using the services they're entitled to. So they may have coverage, but it still is a gap. They can't get the services they need. Then, like I mentioned very briefly before, when you actually start talking about keeping your insurance, we know you have to report changes in a timely manner or you could lose coverage. If you have changes in your household or like a renewal is coming up and you don't know that that's coming up, you could lose coverage right at the date of renewal. That's called churning, where the state of Wisconsin actually sees that they lose most people at the time of renewal for failure to renew or because people simply didn't know that that was a step that was required of them. So again, we have a lot of hoops and hurdles in the way administratively for folks even to get to the program and to keep the coverage once they have it. And it could get worse. Right now, we have on the books in the state of Wisconsin some additional hoops and hurdles, more rules to have work requirements, some premiums, a health assessment, all for childless adults. It hasn't been implemented yet, but that's on the horizon. You can bet there will be additional coverage gaps in the state of Wisconsin when those additional rules hit. So we've been talking about all of the changes, the ways to count income, the ways to prove you are saying what that you make the income you make, or you have the immigration status that you are of, and it makes it very complicated for people to connect to the coverage and therefore the care that they need. So let's sum this up. There are opportunities, of course, to lose coverage, but with the right assistance, with the right consumer assistance, you can minimize those gaps. You can keep people with the continuity of care and coverage that they need. The emphasis moving forward in any conversation about healthcare and coverage is to get rid of the myth that there are no gaps, but instead focus on trying to minimize those gaps and make it a little bit more accessible for more people to actually have the coverage they need. Like I said, part of that broader Medicaid expansion conversation will be how can we make this easier for folks with an emphasis on consumer support and assistance, connect individuals to the appropriate care and coverage, which is going to make them healthier, but also reduce uncompensated care in the state of Wisconsin, which right now, for just hospitals alone, is well over $1 billion. If you have your own thoughts on the coverage gaps in Wisconsin and how to minimize that, you can send us a message. You can find us at healthwatchwisconsin.org.